Hello, welcome to Anatomy DAHAR series. I am Dr. Hamid, Rashid. Today's topic is blood supply, nerve supply and lymphatic drainage of the nasal cavity. General principle of blood and nerve supply of the nasal cavity. Each nasal cavity has two walls, lateral wall and medial wall, the nasal septum. Based on the developmental origins, each wall can be divided into antero-superior and postero-inferior parts. The antero-superior part of the nose originates from the frontonasal prominence of the first pharyngeal arch, and the postero-inferior part of the nose originates from the maxillary prominence of the first pharyngeal arch. Blood supply and nerve supply of each part of the nose, therefore, follow that of their developmental origins. Artery of the antero-superior part of the nasal cavity is ophthalmic artery, a branch of internal carotid artery, and its nerve is nasociliary branch of the ophthalmic nerve, that is the first division of the trigeminal nerve. Therefore, branches of the ophthalmic artery and nasociliary nerve supply the antero-superior part of the nasal cavity. Artery of the postero-inferior part of the nasal cavity is maxillary artery, a branch of external carotid artery, and its nerve is the maxillary nerve, that is the second division of the trigeminal nerve. Therefore, branches of the maxillary artery and maxillary nerve supply the postero-inferior part of the nasal cavity. Veins are associated with the corresponding arteries. Arterial supply of the nasal cavity, as we have presented in the general principle of blood supply and nerve supply. The antero-superior part of the nose originates from the frontonasal prominence of the first pharyngeal arch. Artery of this prominence is ophthalmic artery from internal carotid artery. Branches of the ophthalmic artery which supply the antero-superior part of the nasal cavity are anterior ethmoidal artery and posterior ethmoidal artery. The postero-inferior part of the nose originates from the maxillary prominence of the first pharyngeal arch. Artery of this prominence is maxillary artery from external carotid artery. Branches of the maxillary artery which supply the postero-inferior part of the nasal cavity are sphenopalatine artery and greater palatine artery. The most antero-inferior part of the nasal cavity is supplied by a branch of facial artery from external carotid artery. That branch is septal artery. Arterial supply of nasal cavity. We have two diagrams here. This is lateral wall and this is medial septal wall of the nose. As we have presented earlier, each wall is divided into two antero-superior part which derive from frontonasal prominence and postero-inferior part which develop from maxillary prominence. Each prominence has its own blood supply. This antero-superior part developed from frontonasal prominence. Its artery is ophthalmic artery, so this area will be supplied by branches of the ophthalmic artery, that is anterior and posterior ethmoidal artery. Anterior and posterior ethmoidal artery. This is postero-inferior part which developed from the maxillary prominence. Artery of this maxillary prominence is maxillary artery. So this area, postero-inferior part, will be supplied by the branches of the maxillary artery. They are sphenopalatine artery and greater palatine artery. This most anterior and inferior part is supplied by septal branch comes from facial artery, which comes from the external carotid artery. If you see the nasal septum, you will see the terminal branches of anterior ethmoidal artery, sphenopalatine artery, greater palatine artery, and septal artery anastomose at antero-inferior quadrant of the nasal septum, forming a little blood plexus called Kisselbach's plexus. This area is also known as little area. It is clinically important because it is a common site for epistaxis, nose bleeding. The venous drainage of the nose. In this slide, we are showing two diagrams, lateral wall of the nose and medial septal wall of the nose with their veins. Veins of the nose generally associate with respective arteries on the lateral nasal wall and medial septal wall of the nose. Area A. This is the area A, that is antero-superior part of the nose. In this area A, the veins are anterior and posterior ethmoidal veins, 1 here, anterior and posterior ethmoidal veins, 1, drain to the superior ophthalmic vein, 2, and then drain to the cavernous sinus. B. Veins that associate with branches of the maxillary artery. B. That is the area, postero-inferior area of the nose, supplied by the maxillary artery, will drain to the sphenopalatine vein 3, and then to pterygoid plexus of vein 4, and then finally to the cavernous sinus. C. This is the area C, anterior and inferior part of the nose. Vein from here drains to the facial vein. Rarely, area D, here area D, that is in 1%, and emissary vein D may pass the foramen cecum in front of the cribriform plate and connect the nasal veins with the superior sagittal sinus in the cranial cavity. Veins of the nose are devoid of valves. Nasal infection can spread through these roots to the cavernous sinus and into the cranial cavity. So, not only veins of the nose are clinically important, terminal branches of the artery we have already discussed, which comes from internal carotid artery and external carotid artery, also anastomose in the nasal cavity, one of the anastomosis sites between the two systems. Nerve supply of the nasal cavity. We have already presented in general principle of blood supply and nerve supply of the nasal cavity. Anterior superior part of the nose originates from the frontonasal prominence of the first pharyngeal arch. The nerve of this prominence is nasociliary nerve, comes from ophthalmic division, that is the first division of the trigeminal nerve. For general sensory, branch of the nasociliary nerve which supply the anterior superior part of the nasal cavity is anterior ethmoidal nerve. The posterior inferior part of the nose originates from the maxillary prominence of the first pharyngeal arch. Nerve of this prominence is maxillary nerve, comes from the maxillary division, that is the second division of the trigeminal nerve. That is also general sensory. Branches of the maxillary nerve which supply the posterior inferior part of the nasal cavity are posterior superior lateral nasal nerve and greater palatine nerve from the pterygopalatine ganglion and anterior superior alveolar nerve. The olfactory area is supplied by first cranial nerve, olfactory nerve, for special sensory smell, that is odor. Its branches are olfactory nerve fibers. Nerves of the nasal cavity. In this slide, we have two diagrams. This is lateral wall of the nose and this is medial septal wall of the nose. As we have stated earlier, anterosuperior part of the nose developed from frontonasal prominence and its nerve is ophthalmic division of trigeminal nerve, and its branch is anterior ethmoidal nerve, which supply this anterosuperior part of the nose. Posterior-inferior part of the nose developed from the maxillary prominence and its nerve is the maxillary nerve. So the nerves which supply this area come from the maxillary nerves. They are posterior superior lateral nasal nerve, greater palatine nerve, and anterior superior alveolar nerve. Most of the branches, that is coming from the first division and second divisions of the trigeminal nerves, are sensory nerve. Secretomotor parasympathetic fibers comes from the pterygopalatine ganglion. The olfactory area, this is the one olfactory area, is for special sensation, for smell, odor. It is supplied by olfactory nerves, that is the first cranial nerve. Lymphatic drainage of the nose, Robin's levels. The lymphatic of the nasal cavity starts from the capillary network in the lining mucosa. Posterior part of the nose drain into the retropharyngeal nodes, which are at the posterolateral part of the pharynx. Anterior part of the nose drains into the submandibular lymph nodes, which is called Robin's level 1B. This is the one. So level 1B receives lymphatic from the retropharyngeal nodes and finally to the submandibular lymph nodes. From level 1B drains to level 2. This is level 2, which is also called upper deep cervical nodes or jugulo-digastric nodes. From level 2, it will drain to level 4. This is level 4. This is also known as lower deep cervical nodes or jugulo-omohyoid nodes. From the level 4, lymph will drain to the jugular trunks, that is right lymphatic duct on the right side and thoracic duct on the left side, drain to the venous system. In summary, lymph capillary networks from the walls of the nose drain to the retropharyngeal nodes and from there to the submandibular lymph nodes, that is level 1B. From there drain to the upper deep cervical, also known as jugulo-digastric nodes, level 2, and from there lower deep cervical nodes, also called jugulo-omohyoid nodes, level 4, and finally through the jugular trunks, that is right lymphatic duct on the right side, thoracic duct on the left side, drains into the junction of internal jugular vein and subclavian veins. So finally enter into the venous system. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Free medical education. Thank you.